doctors would be like, well, just take like this really, really, really strong painkiller. And I was like, am I supposed to live on painkillers?
Mm-hmm.
Is this supposed to be normal?
We met 3 years ago,
Yes.
right? Remember, you came to my office and you were at your wit's end, so frustrated with vulvodynia,
Yes.
right? Please tell us how you felt when you came to Well Women Acupuncture with that issue that you can explain what it is. We know it's not a disease, it's a condition.
Yeah, well, it was in 2019, in the summer of 2019, I started dealing with some pain. And at the time, I didn't know what was happening with my body. One day I was fine, and the next day I was in pain. And I would try to figure out what had happened in my life, in my diet, in my workouts, and I couldn't figure it out. So I went to see my doctor at the time, and they said, you probably have a yeast infection. And they gave me some medication. And I said, great. Like, I've had one before. It'll go away in 2 days. And it never went away. So I knew there was something else with my body, and I just couldn't figure it out. So I started going to other doctors, and they would say the same thing. And then the pandemic happened, and my life slowed down, and the pain went away. And I said, great, maybe it was stress or something. And like as women, every time you have certain pain or condition and you express it out loud, a lot of people go and say, have you tried meditating? Maybe you're too stressed. And you're like, no, I know my body. I might be stressed, but I also know there's something going on. So a year later, the pain came back. And this time I couldn't stop it with anything. And it's like a burning, itching sensation. It's very similar to a yeast infection. So people, I'm not surprised, every doctor I saw would say that and would try to give me medication for that. But I knew it wasn't that. And I tried to change my diet, and I tried to work out differently. I started doing yoga. Of course, I was meditating. Of course, I was doing everything that they tell women to do when they feel bad. And I was in Mexico City, that's where I'm from, and I decided to see one last doctor. And I said, I just can't figure it out. Like, this pain is really frustrating. And I knew by the time, because of my own research, what it was. And I knew it wasn't a disease. It was the effect of something else. I just wanted to know what that something else was. And I was at the doctor in Mexico, and we were trying to address that. And I said, by the way, I'm 30-something years old. I've never been pregnant. And I want to, like, if you can right now, just check me also to see how my fertility is going. Because, as women, we have a ticking clock. And although I wasn't like trying to get pregnant at the time, it was funny that I had been married for almost 4 years or something like that. And never happened. And I was pressured because of work and other things. And long story short, she said, let me call my colleague. He's an expert in fertility, and he'll check you out. So he checked me, and he said, why are you here originally? And I said, well, I have this pain that won't go away. Everyone tells me it's a yeast infection. I've taken every kind of medication. I've changed my diet, my workouts, and it's just not going away. But also, I want to know if I'm fertile or not. And he said, well, you have an endometrioma. Have you ever been told that you have endometriosis? And I was like, what? Like, no. He said, yes, you're telling me. Like, he started to ask me a lot of questions. Do you have painful periods? Yes, everyone does, right? He's like, no. Do you have painful periods that make you not want to go to work or not want to go to school? And I started to think backwards, and I said, yes. Like, there were days in school where I had my period and I just could not function. And at the time, I remember that doctors would be like, well, just take like this really, really, really strong painkiller. And I was like, am I supposed to live on painkillers? Mm-hmm. Is this supposed to be normal? After a bunch of questions, he said, I'm pretty sure you have endometriosis. Where do you live? I said, Los Angeles. He said, there's really good doctors there. If you want to have surgery here, you can. But like, if your life is there, you want to recover there. And I said, yes, that makes sense. So I came back to LA, and I didn't know what to do with this diagnosis. I was 34 years old or something like that. And I was thinking, I've had my period for over 20 years. How come I'm just learning this about myself? And the pain was still there. So I said, okay, I'm just going to focus on the pain and I'll leave this endo thing on the side. I don't even know who am I going to talk to about it. So I was researching online different treatments that were not traditional medicine, and I found your webpage. And I said, great, I've done acupuncture once or twice, but I have a really good feeling about this. And I email, and I remember thinking, well, I've always had really bad luck when it comes to doctors because they can't see me on the weekends. And I had a really demanding job at the time. And I remember being very honest with you with my case. I said, I have this pain. It's called vulvodynia. It won't go away. But I also received this diagnosis of endometriosis. And I just want to live my life pain-free. And you replied something like, I'm really interested. I'm only working during the weekends on Sundays. I am very interested in seeing you. Can you come next week? And I was like, this is perfect. And when we talked, it was the first time in almost 2 years that I finally felt understood, that I didn't have to over-explain my case, that I felt that there was this connection. You opened about your own situation with endometriosis. You shared all your knowledge and experience. And I remember like having second thoughts saying, okay, this is something that might or might not show up in an MRI because that's something that I learned. How am I going to put myself in the hands of a surgeon if I don't know what's inside me, if it's there or not? Because you recommended me to watch a documentary, and they say sometimes it's hard to diagnose because it won't show up on an MRI. But in my case, they saw the endometrioma. So there was definitely something wrong. And you refer me to Dr. Orbuch, whom I met with a couple of weeks later. It was my first time talking to a doctor. Again, that the same thing happened.
He understood you?
He not only understood me, but he didn't make like a funny face, or he didn't question me. He didn't say, are you too stressed? Or this is he said, you don't have any infection. You've never had one. And what you have is inflammation because of endo. And that's pinching your nerves, and that's causing your pain.
Did you cry with just like...
I cried. And also I was like, I have no idea what's going on in my body.
And here was somebody who broke it down into such a simple thing after 2 or 3 years, 4 years of pain and the restrictions and the frustrations and the limitations that having vulvodynia and period pain puts on us as women.
Absolutely. And it was I felt relieved, but I was also scared because then...
What does that mean?
It makes you want to... I saw some of the best doctors in LA and in Mexico, and none of them were able to tell me this. And he told me, well, the pain is it's going to take some time, but there's something called pelvic floor physical therapy. He gave me a list of people that do that. He said, you can go here, here, or here. And I was like, what? How is my pelvic floor connected to my pain? And I remember I even like put that off for a while. I said, okay, this is too much information. I'm going to start with the surgery, and then we'll see what happens. And I remember calling him before the surgery and being like, doctor, I'm still in a lot of pain. When is this going to go away? And he would be like, okay, have you started the PT therapy, the pelvic floor therapy? And I was like, no, but how is that related? And months later, after I completed my pelvic floor therapy, I was like, okay, everything is connected.
It makes sense. As in Chinese medicine, we say the uterus is the second heart and the vagina is the second brain. And so your first brain really needed to understand, how would this help me, before you go and lay in a room and have the awkward transactional procedure of pelvic floor therapy, which we can both attest to is not awkward. It's very healing. It's a very helpful procedure or therapy where you connect with your pelvic floor therapist and they're able to explain what they're doing. And she's able to explain to you how the tightening of those ligaments is creating pain around the urethra or pain with intercourse or yeast-like symptoms, right?
Absolutely.
So you started to trust her and him and me and maybe life and the process. And so your nervous system was able to start down-regulating and calming down, and healing was able to start happening.
Yeah.
So what happened next?
So I had surgery with Dr. Orbuch September of 2021. I remember having the call with the anesthesiologist the night before. And he would say, okay, like, how are you feeling? And I was like, I'm panicking. He said, why? Because I still doubt that when they open me, they're going to find this tissue. And it's going to be the cause of my pain. Because for 2 years, I've been hearing, and I believe in doctors. Like, I'm a firm believer in medicine. But I was misdiagnosed so many times. And it was not that I didn't trust Dr. Orbuch. I just didn't trust my body because at that point, I was like, I have no idea what's going on in there. And so he was like, don't worry, like, I'll take care of that. Uh-huh. And I went into the surgery. I came out and I just felt very different. And at the time, I had a friend who I saw posted something online about her endo surgery. So I called her days before mine. And I was like, how does it feel when you wake up? She said, I felt great. You're going to feel great. Trust this process. Trust your doctors. Trust your body. So yeah, I woke up from the surgery and I felt amazing.
The nerve block
it was
probably helped that feeling.
It was incredible. It was like, and the thing with inflammation that I have learned through you, the SEED program, coming here and just educating myself is that inflammation is the worst enemy of the body. Mm-hmm. And what endo causes is deep inflammation. And in my case, it was no surprise that I was never able to get pregnant. It was no surprise that I was having such painful periods and just like a very painful life physically. And at some point after you've been in physical pain for a long time, it's just very debilitating. Like, it affects your relationships, it affects your work, your mood, everything, because you're in a fight or flight,
upregulated state
all the time.
Yeah. Mm-hmm. So you came out of the surgery and we were doing acupuncture leading up to the surgery. And I think we should probably go back and talk about how when we have an endometrioma, it's implied that there is endometriosis. You don't just get a cyst in your ovary without endo being at other places in the body. So there was that. There was so much information that was leading you towards this surgery to help remove the inflammation at the root. And that's what Dr. Larry Orbuch and Dr. Iris Orbuch, what they both do, but they take a holistic approach. So did Dr. Orbuch tell you to look into SIBO or to work with a pain specialist?
Yes.
With all of the team that he's connected to, I know he did that in my care. So what did he lead you to do?
I think that was the thing where I knew I was at the right place, where when I saw him approach the problem from different areas, he said, do you feel inflammation in your stomach? Yes. Then try to go see
bloated?
Are you bloated? So I think we both went to see the same doctor, Dr. Tristan, right? Uh-huh. And the pain specialist. So I felt for the first time that I was contained. I also felt that I was talking to someone who really, really knew the area of expertise of endo excision, because if something I learned was that there's very few doctors that do excision, which is different from ablation, right? Because ablation is like you're going to cut the tissue, but it's laser, so it might grow again, and it might grow again in a year or in 2 years,
or
right?
the next time you have a menstrual cycle, and the
Right.
hormones set it up for it to come back out because it's estrogen dominance, progesterone insufficiency, an inflammatory response. So if they just shave that top layer off, then the next hormone storm and it just comes right back out.
Yeah.
Or inflammatory food, or you eat a pizza full of gluten.
And what was fascinating is that for some reason, I reconnected with some friends who were also survivors of endometriosis. And when I started opening about my symptoms, and I was like, hey, because it's so taboo to talk about certain pains. Like, I was not just going to scream out there, hi, I have pain in my vagina. Who has pain too? Like, who can share what they're feeling?
Right.
Like, and then once I started talking to them, it was like, okay, we're all experiencing some kind of pain, but we're ashamed to tell each other. And we have to dig in the darkest websites on the internet to see. Like, I remember like reading some woman in Greece had similar symptoms to mine. And I was like, okay, how do I call her? Like, what am I going to do?
Mm-hmm.
And, that's why I think it's important, and why I'm here talking about this with you, and why I think that what you're doing is incredible, because women, we're not allowed to, or we're told that we're not allowed to talk about certain topics or to share too much information because it's embarrassing or because there's shame. And what's really shameful is to not have access to this information, because you never know. Like, I remember specifically a friend of mine telling me all her symptoms, and I was like checking and she had already had excision surgery. And she even told me about the hormones. She was like, there's certain hormones that they put you on after the surgery sometimes. And she was like, if you want to get pregnant, talk to your doctor about it. Like, she was the one who had already gone through that. And she was sort of guiding me, of course, with you and Dr.
Thank goodness
Orbuch.
for her.
But yeah, she was one, like, another angel that was sent to me to just bond over this.
I'm just thinking about living here in Los Angeles, right? So I'm a particularly odd case, right? I talk to women only about their deepest, most intimate fears, concerns, worries, experiences, traumas, a history. And then I go to events or something and I see everybody else talking about like jewelry, handbags, superficial, hair coloring, stylist, fashion. And I can't even relate because I can't pivot that quickly from the deep transformative work that is my career and my calling into the superficial conversations. And now I'm hearing you couldn't get any of the deep conversations, and how sad that is. But thank goodness for this friend of yours, and thank you for you to be here, to be vulnerable and to share and to help me get information out there to women that are listening, that are thinking, oh, maybe it's not normal that I throw up with my period.
Yeah.
Right.
Or that I can't go to school, or
that it hurts when I have sex with my partner.
Absolutely. And now, well, if I have a 5-month-old daughter, which we'll talk
Spoiler alert.
We'll talk about it later. But during my pregnancy, I didn't like some of the advice that other women give you because every experience is different. But another good friend of mine was pregnant, and I said, I know I don't like to hear all kinds of advice, but I'm going to give you just one. And it's the only one that I beg you to follow. Do physical therapy. Go find a pelvic floor physical therapist that can treat you before and after your pregnancy, because you're going to appreciate that so much. And I say this because now that I'm a mom and I talk to other women that are or have been postpartum, I start to hear, yeah, well, I have painful sex and I have this pain and I have that. And I'm like, well, have you checked if you have endo? Have you checked if you have a tight pelvic floor? I just want to go out there and scream like, women, go check yourselves. Find the experts.
Right. It's another part of our body, and to understand how our breathing affects our pelvic floor, right? And how our pelvic floor affects our diaphragm and our breathing. It's all connected. It's like so empowering to realize, oh, I've been breathing wrong all this time, and maybe sex could have been easier if I knew how to breathe properly. It's a
Absolutely.
really eye-opening thing, and the more that we normalize it through conversation, the better.
Yeah, and the other thing is that also I feel like we as women sometimes we care about a lot about the exterior of our bodies, and going back to what you were saying about living in LA, like I remember always like sticking up my stomach, like inside,
Sucking it
in,
Mhm.
and doing these workouts that were very aggressive on my core, and everything was connected. And when I started to get in touch with like through your program and through your practice, like this is supposed to be soft. This is what's going to carry my baby.
Mhm.
Like, why am I trying to make this hard if it's supposed to be soft, and it's supposed to expand if I get pregnant? And all these connections that I started making of how I treat my body and where am I paying attention. If I treat my inside, then it's going to show in my outside. But if I treat only my outside, it's not going to affect my inside.
Right. That's so astute, so brilliant. You know, Dr. Baek once told me, we were talking about a particular mutual case who had such tight abs, it would be hard for me to put the needles in. And then Dr. Baek said that it's also hard for her to move the ultrasound wand and to get to where she needs to be because those abs were so locked in place. I wouldn't even say that it looked good. It just fits a societal model here, particularly here in LA. And that is part of my work, to help women feel more comfortable with a little bit of softening and changing, and to not hold the reins so tight too.
Yeah. And I remember when I started doing the seed program, and you recommend to eat like full fat, like cheese and milk.
Well, unpasteurized, not the full fat regular milk.
Yeah, right. Unpasteurized milk.
Yeah, raw cheddar.
And but I was always like eating like fat-free yogurt and fat-free
avoiding
cheese,
dairy because they were telling you had a rampant yeast infection.
Yes.
You didn't even have discharge. You didn't have any signs that would, and you weren't testing positive yeast cultures.
No.
Were they giving you the medications? So did you not take them?
Yes, all sorts of medications, which I think it even ended up affecting me more. But yeah, going back to like being more in touch with my feminine side, knowing that being soft is okay, that if I have to gain a couple of pounds to be healthy, if I want to get pregnant, it's okay. It was part of like this whole work of knowing that it's more important to take care about my health and my inflammation than how I look outside.
So remember, in the SEED program, the way that I present food as fertile medicine is I discuss these foods are anti-inflammatory. Mm-hmm. These foods are acidic. These foods are alkalizing. We started there. That's how I like eased in to make it very clear. Like if you have too much sugar, too much meat, too much processed foods, Starbucks coffees, those foods are heat producing and acidify the system, which prematurely ages the eggs and pours gas on an endometriosis fire, right? But then over here, we have alkaline foods, and I make it very clear, you can't just go and eat alkaline all the time because those are foods like green juices, green soups, leafy greens, dandelion greens, cucumbers, kale, spinach, avocado. All of that is cooling to the system. So you can't swing and go to that other extreme and be too cold because then you stop ovulating. Mm-hmm. Ovulation is an inflammatory process. So if we dampen that inflammatory fire too much, then we go into anovulation, and that's a problem too. So it's the sweet spot of how to use animal foods, how to use greens.
Yeah.
And that lovely mix, right? And then we go into what to eat during your period, what to eat as you're approaching ovulation, and the whole fat, raw, pasteurized, unpasteurized dairy and eggs and minerals, seaweed and sushi.
Yeah.
All of that, minerals and good fats, calms the nervous system, which is exactly what Endo sisters need.
Yeah.
And it lessens the prostaglandins, like the pain modulation cascade that makes the pain and the cramping worse at ovulation and at the period. So the thing that the women do is they start the seed program, and then they come in and tell me how much better they're feeling.
Yes, absolutely. I think after I had my surgery, I was scared to try to get pregnant because I had all this information of how effective my system was from years.
So
and
you
years
were
of
worried that
endo.
you would get pregnant too soon?
I was worried that it was going to still be hard because there was damage in one of the fallopian tubes. There had been a cyst there for, I don't know how many years. I mean, during pandemic, I couldn't go to the doctor. So like my last ultrasound before 2021 was in 2019. So could be
2 years.
Could be there for 2 years. I don't know. That was what I was like, so worried about, because the surgery went great. Dr. Orbuch was the best, and I felt incredibly well. But I said, well, this is damage that has been there for over 20 years. How am I going to revert this? And am I going to be able to get pregnant? And is it going to be a successful pregnancy? And so I didn't want to, and I was also a little bit scared. What if it doesn't happen fast? What if I have to go do other round of like medical procedures? And I was still in a little bit of pain because I was just starting the PT, the pelvic floor therapy. But by May of 2022, I said, I'm ready. And me and my husband were like, okay, let's see if this works. And I've been doing the seed program, and I was like, okay. And then I got pregnant.
You got pregnant
really fast. I couldn't even believe it. I was like, oh, so it was the endo.
It was very validating that with that inflammation removed, then maybe 2 ovulation cycles after having the surgery, you conceived.
Yes, it was. I just couldn't believe it. I was like, oh, this is super easy once you address the problem, right? Unfortunately, I had a miscarriage. And I remember I signed up for your grief and loss program.
Healing after loss.
Yes. And it was
you were surprised that you conceived so quickly, and then you were surprised by how much it hurt your heart to have it literally slip through your fingers.
Yes, it was like,
it seemed like a cruel joke to be witnessing that happen for you after all of the time spent listening to yourself to find the answer to the vulvodynia, and then to have the courage to go through the surgery, and then to have this sudden pregnancy, and then to have it end in such a quick way was just so unfair.
And you know what? Now I just recently had this ceremony that they do in Mexico and other Latin American countries where they close your hips. It's called like the hip closure ceremony or something. And you go over your pregnancy and what happened before, during, and after. And I cried again. And I said, well, I've cried about this so much. I just didn't think I was able to cry about it again. And yeah, and that's the beauty of your programs, is that it's not just about what you eat, it's also what you think and what you feel. And I remember it was a Friday night, and I was crying in my bed. I just, and everyone tells you, or a lot of people tells you, like, it's normal. And it can be normal, but it can be common, but it's not normal. Having a loss means, again, like, what is my body telling me about this? And I signed up to your program, and I remember I got an email from you saying, what happened? Because I had seen you and I told you that I was pregnant. And I said, I don't know. It just happened. And at the time I didn't have a doctor here in LA. So I went to see Dr. Orbuch. Because again, he was like the only doctor I trust in the world now. And 2 months later, I got pregnant again.
Mm-hmm.
And I was like, okay, something is working in this body that I'm able to get pregnant really fast. But again, I had another miscarriage 2 or 3 weeks after I found out that I was pregnant. And it was so disappointing because it felt like life was giving me this treat and then taking it away from me.
Mm-hmm.
And I think that's one thing that I worked really, really hard with you, to trust the process, to surrender. I listened again to the whole seed program.
Did you go back into the Healing After Loss course? Because remember how I put together a list that says, here are the reasons why women are having these losses and what you can do to diagnose or pursue some treatment. Because unfortunately, due to the limitations of time that the doctors have, they can't tell you every possible thing that could be going on with you. And since there are women in different countries using the seed program who I will never meet, but if they have this as an online resource, then there's a list of different things that say things like, did you rule out autoimmune antibodies? Did you rule out killer cells? Did you look at the thyroid function? Did you look at the thyroid antibodies? Did you look at the endometrial lining? And various different things. So like a whole long list of things. So you had seen that, but I think, as I recall, you asked me to refer you to a fertility specialist so that you could continue with your deep dive journey. Am I remembering that correctly?
Yes. You mentioned Dr. Baek, and I went to see Dr. Orbuch again with the second miscarriage because I still didn't trust any other doctor at the time.
And we'll never know if those were genetically normal eggs or not, but you did get an answer. So
yes. And again, I felt like in my path towards becoming a mother, I had to surrender one more time and say, okay, this is happening, but it's not happening as I expected it to happen. So I went to see, and I must say, my husband, and you know him, he came here, he treated himself as well, and
he received treatment.
He received treatment here. He went to see also the doctors that you recommended. We were like, okay, if there's one person we're gonna listen to, is Danica. Whatever she tells us to do is like, we're gonna do it. If she tells you to drink raw milk, you're gonna drink the raw milk because I'm drinking the raw milk.
But I have to say, when the husbands come in here and they do it together, those couples, I can't even think of one couple that I worked with where it didn't work out. So I think energetically, it tells the universe we're really serious about becoming parents.
Yeah. Looking backwards now, it was a blessing, everything that happened. I know it's so cliche, but it really made us think at some point, why do we want this? And it also made us think, what if it doesn't happen? Is our life going to be ruined because of that? Can we still be happy if we're never parents? How, and this reminds me of something you said, because in your experience, you said you used to be like a mother for your patients, even when you were not a mother of your
when
children.
I was told I wouldn't be able to have kids,
exactly,
I recognized that I was mothering everybody in the office.
And I started seeing, how am I mothering people in my life? If it never happens for us, I can still be a mom to my little sisters, to my niece, to my friends that are 10 years younger than me. And I was okay with that. And it was because of your program that I started listening to other stories of other women. Some conceived through IVF. And I was like, okay, I'm open to do IVF. Others conceived through surrogacy. And I say, okay, if it's in my possibilities, I'm open to that. I think the ability to be open to make this happen or not was what truly gave me the chance to feel free, and to also, for me and my husband, to be very conscious, like, these are the specific reasons why we want to be parents. It's not because it's what's next. It's not because it's what my friend is doing. It's because we, as a couple, we really want this because of A, B, C, and D. But if it doesn't happen, we'll find ways to be happy. And when I saw Dr. Baek, as you say, she also had a list of things. And as I expected, because my fallopian tube tube was so damaged, there was like speculations that maybe the eggs were coming from that tube, or, there was a lot of information also in that appointment. She's so knowledgeable and so smart and very direct. And I really appreciate the way she told us everything. And then she said, okay, there's a bunch of tests we can do, but the one red flag that I'm going to start with is your thyroid. And we checked my thyroid. My TSH was high. She gave me medication. I started taking the medication. And again.
And so before you say something more, the thyroid needs to be optimized. I think Kelly keeps it below 2.5, TSH below 2.5. And then there's the antibodies concerned. We have to make sure that the thyroid, the body isn't attacking the thyroid.
Yes.
Did you have thyroid antibodies?
No, because they tested me for Hashimoto and all of that.
Yes.
And I didn't have that, thankfully, because then it was just a matter of regulating my TSH.
So I think that the thyroid is adversely affected probably by the inflammation of endometriosis, right?
Yes.
The whole body system runs on the thyroid. And when we have endometriosis, we are like driving a car with a flat tire. And so it's pretty hard. It can roll a little, but it's much harder. So the thyroid is another analogy I use for the thyroid is that it's like a preheated oven, and we want to bake a little bun, right? So we want it to rise. We want the yeast to rise. So we don't want to put the bun into a cold oven. The temperature needs to be preheated adequately so that put it in, you cook it for the 40 weeks, and then you take it out and it's this healthy baby. So your thyroid was wonky. It was off.
Yeah. And I remember you even gave me some recipes and some food that I think curry, you said.
Warming foods
to
keep the temperature up.
Yes.
And to move the blood. So the warming spices, turmeric, ginger, those are good foods for wiping out the thyroid, and also wiping out the inflammation cascade in the endometriosis.
And I think once again, I had no idea how my body works. I have no idea about my hormones. I remember when Dr. Baek said, well, your left tube is damaged. And I was like, well, I'll just try next month because I'm going to ovulate from the right tube next month. She's like, no, that's not how it works. I was like, okay, I'm so ignorant. How does it work? and it's just, we have no idea how hormones work, how our bodies work. And it's because, I don't know, like for some reason, we focus on the wrong things. I've done every kind of diet out there to look a certain way. And I don't know if that even affected my endo, my thyroid. When you go on a diet and you're like, okay, I'm just going to drink coffee as a snack.
If you do too much keto, did you do a keto?
At some point in my life, yes, like carbs are bad. Don't eat carbs. Like, how am I going to have a balance in my life if I'm cutting out foods, like food groups, not just like inflammatory food. But yeah, it was. I was 36 by the time, 36. And I was like, I have no idea how my body works, and all the damage I've been doing just for focusing in the wrong reasons. Like, so I kept coming here every week. And at some point I told my husband, you know what, this is devastating for me. I just want to freeze embryos and wait 5 years, go work on my career, become really successful. And then one day I'll come back and pay a surrogate, and that's how we're going to have a baby.
Translation. It's become so intense for me that I want to just remove myself from the process, or at least like feel a little bit more in control of when and how and what happens to my body. And so that was actually not a disempowered thought. That was more like self-protection. That was like the most loving thing you could have said to yourself and to Malcolm at that time. It really made sense to me. I didn't feel like that was you giving up. It was you just saying, I think I need to pause a little.
Yeah. And I've always been so medical driven, and I trusted Dr. Baek, and I trusted Dr. Orbuch, and I trusted you. And remember listening to a podcast, and this woman was talking about her fertility journey. And she said she was doing the opposite. She was reading the Spirit Babies book, and she was doing everything very holistically. And then she surrendered and said, I need to add the medical part into my journey. And she ended up doing IVF and having a very successful pregnancy and delivery. In my case, I said, well, I'm just going to try to read these books about spirit babies and whatever. Like, I don't know if it's going to work or not. And I think it was a combination of my mental shift of I'm open to everything. And at the same time, I was protecting myself, saying, okay, I'm going to do the IVF. I'm going to freeze the embryos, and I'm not going to think about this in the next 5 years. And it was just, it was magical because magical because I was determined on one hand to open to these things with a lot of fear that what if it doesn't work out? And then on the other hand, I was like very determined to just like freeze my embryos and don't take care of it. So at some point between those and me surrendering just to everything, I had my appointment with Dr. Baek on a Tuesday or Wednesday to sign all the paperwork before you freeze embryos.
To get started with that cycle?
Yes. And it was a Sunday, and when you were going to start with IVF, they tell you, okay, call us the day you have your period, and then we're going to count from there to start the hormones and the treatment. So I was waiting for my period on a Friday, and it didn't come. And then it was a Saturday, and it didn't come. And I was going to see you on a Sunday. And I said, okay, fine. I'm going to ask Danica, give me one of those powders to get my period going. And then I'm just going to go in and freeze my embryos and whatever. And something told me that Sunday, don't ask Danica anything. Go take a pregnancy test before you go to see her. And I did.
Yeah. And that one stayed. Matilda, her spirit was strong, and your thyroid was optimized, and your relationship had gone through so much strengthening. Because I imagine when you told Malcolm, hey, I think I want to do like a 5-year pause and then we'll put them in later, he was probably thinking, he's
like, I'll do whatever you want me to do, but stop being a crazy woman, please.
Yeah, right. Yeah. Malcolm is the best.
Yeah,
and so I said this in another episode, as far as we can be tested and we meet the tests that come along, for me, it was surrendering to the idea that I would do a foster adoption situation of a teenage girl. That was where I decided, I thought that's what I could do. And when I made that decision, things shifted and my ex came back into the picture, and I had my opportunity. Here for you, it was, I'm going to let science handle it, and I'm just going to pause motherhood, and I'm okay with that. And then your destiny shifted, right?
Yes. And it's really funny because it was my third positive pregnancy test in less than a year. And it's a different feeling after you've had losses, because it's not that I wasn't scared.
And you also weren't like detached or how did you feel?
I don't know. I felt so different physically from the other 2 times. I don't know if it's because
was supported by the thyroid medication.
Yes, I think because my thyroid was balanced, I didn't feel the same symptoms I felt the first time. I was very happy. I was very thankful, but I was also very much in the moment thinking, this is today and I'm going to celebrate today. And I remember we both came to your office and I was laying down, and then you walked in and he was there. And I usually, I would come in by myself, and then he would come in when he was getting treatment as well. And you saw both of us, and I said, I'm pregnant. And you said, I knew it.
Mm-hmm. Yeah. It just was like the next, it made so much sense watching you surrender and optimizing the thyroid. Makes a big difference. I wish that we had known that before, but I think there were so many decisions and so many different things that you were doing. You were also having situation with your father was ill, and the work stuff. There were so many other things that were going on, and It really is our destiny, and the divine is always right on time, is
Yeah.
the one of the many things that I remind my patients. So, Matilda was a few months beyond where that
Yeah.
first pregnancy was, but she was the egg that made her,
Yeah.
right?
And I went on to have a really good pregnancy. For women, I've heard this before, for women that have had losses, every time you feel like, oops, there might be like a little bit spotting or something, you run to the bathroom and you're like, please, 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 I don't want to see any blood in my whole pregnancy. And that happened. That happened to me.
It happened that you didn't,
that I didn't,
no scares?
I didn't have any scare in my pregnancy. There's something that you talk about. I think it's like the fertility trust, or the confidence in your
fertile confidence.
Fertile confidence, that I kept thinking I did the right things. We did the right things, my husband and I. And also, it's not up to me. Like, if it doesn't happen, it's not, because I remember when I got pregnant with Matilda, they asked me to be in bed rest for 2 weeks, and I wanted to go to a concert or something, and I canceled that. And then someone told me, like, it's not because you're gonna miscarry if you go to the concert. It's because if anything happens, you're gonna blame yourself for going to the concert. And the truth is that there's always going to be blame. I remember my first miscarriage, I started working with a personal trainer that day. And I was like, it was a personal trainer. I shouldn't have worked out that day. The second one, I remember I was having 1 cup of coffee because I was really tired because of work. And the doctor had told me 1 cup is okay. And then I was like, it was a coffee. It was a coffee. And then you just find something to blame. But sometimes it's nothing you did right or wrong. It's just it wasn't meant to be, or at least that's what I decided to learn from that experience.
And I have the opposite situation where Kira and Jack, they were meant to be in the way that they came so easily after 6 years of taking care of endometriosis and optimizing the things that I could. So when we control what we can, and then we have a detachment around how and when, then it really does set the stage for the magic to happen, right?
Yeah.
So you had this effortless pregnancy, but your story didn't end when she was born. Actually, that was like a new chapter.
Yeah.
So let's pick it up at where she's born.
Okay, she
or in the delivery room.
Yes, it was a really good delivery. I was working with a doula. I had a really good doctor at the time. And I felt really empowered and really confident. And I thought, I worked so hard for these. I know my body. I've done the right things. And she came out really fast. And it was a beautiful delivery. And a couple of hours later, I started to feel not very well. I started to notice that I was bleeding a lot. And if I had learned something from my past years of advocating for myself, is to speak out when I feel that something is not wrong. I'm not a doctor, but I am the owner of my own body, and I can tell when something is not right. So I called the nurse. I was at the hospital, and I called the nurse and I said, hey, I think I'm bleeding too much. And she said, okay, we're going to start monitoring you. And I was like, but I need help right now because I'm feeling weak. I'm feeling like I'm going to pass out. I'm passing really big clots. And this is something that's starting to not look very normal to me. And a couple of minutes later, 2 doctors came in and they were checking me. And I don't remember very well, but from what my husband tells me, they were saying, okay, your uterus moved to the left. It's full of clots. We have to...
The placenta moved.
The placenta was
the placenta had already been.
It had come out.
Okay.
This is 12 hours after the delivery, give or take. But my placenta was really big, and my baby was big also. And I went to the bathroom. I said, okay, I'm not understanding what's happening. I just need to go to the bathroom one more time. And while I was in the bathroom, I passed out, and I started bleeding. Like I had a really bad hemorrhage, and I passed out. And when I woke up, I saw like 20 doctors in my room. Couldn't find my husband. And I was really scared. But I just kept remembering, like, you've been through a lot. You're strong. You know your body and you know how to ask for help. Just speak out. And by the time they were connecting me to some machines, and they I don't remember if they tried to explain to me what was happening. But what happened, and afterwards, I went to see Dr. Orbuch, and I told him, hey, this happened. Why did it happen? I want to understand my body. I feel that that's our right as women, is to understand our bodies. And it's called uterine atony. And basically my uterus didn't contract after
the placenta
came out. And there's medication that they can give you so it can contract faster. And I was on that medication, but my uterus, it's a combination of things. After my endo surgery, I was told I have a soft uterus and some adenomyosis, which is not entirely contributed to that, but it's an added
it would
factor.
be like under the umbrella.
Yeah.
Because the softened, and so in Chinese medicine, that's a spleen issue, the softness and the lack of a muscle tone.
Yes.
And the uterus is just a big muscle.
Yes.
So it's making sense where from endometriosis over time, the spleen was weakened, growing the baby in there takes a toll on the spleen, but it's not even about the Chinese medicine. In that moment, here you had this life-threatening scare. And so medicine showed up. What did the doctors do? What was happening? How did they fix it?
They remove manually the clots, and then they gave me the right medication to help contract the muscle, the uterus. And in a matter of hours, I was receiving blood transfusions to recover. And I was just, I was obviously very thankful because I was in a hospital and because I was with very good doctors and because my doctor was on the phone telling everyone what to do. And I felt very lucky about that. And weeks later, when I was talking to my doctor, he said, it's a life-threatening situation, but you were never in the risk of losing your life because you were in the
already in the hospital.
Yes, already in the hospital. And you spoke when you felt that something was not right.
You told us there's a problem.
And I think that's something I learned from all my experience, from seeing you, from having the surgery, from having endo, is that when something doesn't feel right, we need to speak and we need to be heard. Because this reminded me of all the times I went to see a doctor and they were like, oh yeah, you have a yeast infection, take this. And at that moment, I remember I told the nurse, and she was she was the best. But I had to grab her attention and say, hey, look into this. Something is not right. Mm-hmm. And if I didn't have my previous experience, I always joke with my husband, like, he thinks I'm a hypochondriac. And he would have been like, if this would have been a home delivery, he would have been like, oh, let's wait until like tomorrow to see how you
call the midwife to come check.
Yeah. Mm-hmm. But luckily that's my story. And I'm thankful that I was in the right place at the right time.
Mm-hmm. Well, you and Malcolm truly are baby makers, where you allowed the process to form you, and to that process of personal development changed you. You embraced it, and he supported you in those changes. And now here you have Matilda, who's 5 months old.
Yeah, almost
now,
5.
And she is such a light, such a joy. Such an embodiment of the two of you and what you've been through. It's like, here is your reward for that.
Yeah. Yeah. I remember one of, I don't know if it was with Matilda, that you said, if you have a girl, you're going to be able to teach her about her body and about, her how to advocate for herself. And that's one of the reasons why I'm very thankful that you're doing this, because how many women out there, when I was 15 years old, 13, 14, like, there wasn't the information that there is right now. Mm-hmm. And the fact that you put out a program for endometriosis, that it's, for teenagers or for women my age or for anyone who has painful periods. It's something that I would have loved to have when I was younger.
Mm-hmm. Right. That program, especially since we are here at the end of March, right? And March is Endometriosis Awareness Month. That extra course inside Seed Fertility is there to help women make the decision to have endometriosis excision surgery. It's called A Holistic Guide to Healing Endo, but it really is to help them make the decision to either go and have it ruled out or to move forward with having endometriosis removed from their pelvis and add some time to their ticking clock by treating this issue that's at the root that is so hard to get diagnosed and confusing, and it really interrupts our lives. So thank you for sharing that you found value to those programs and the information and the process. And I'm just curious, what would you like to share with other women who have been listening to your story?
I think for me, the most important thing is to trust your body, trust your symptoms. Sometimes, like I remember learning that with the vulvodynia, I was like, okay, what is that disease? And then I went to see another doctor here who's a specialist in that. And she said, it's not a disease, it's just the symptoms of something else. So sometimes a diagnosis, it's not something that you have to live with forever. Like if they tell you have this pain and it's called this, okay, but what is behind that pain? And that's how I found that I had endo. And okay, I have endo, but I'm not a person. I'm a person who has endo. I'm not endo myself. So how do I treat that? So it's hard. I remember at some point I was like, okay, when am I just going to feel okay and have everything sorted out and I won't have to go to another doctor ever again in my life? And now I see it in another way. I feel curious about my body. Now I know I have some thyroid problems, and we were talking about like, okay, I want to go see this endocrinologist that Dr. Baek recommended because now I want to learn about my hormones. I'm 37 years old. Soon I'm going to be talking about menopause. What's next? How am I going to approach that? Like, be curious about your bodies. Don't live with a diagnosis thinking that that's going to be forever. Like, find ways to treat yourself. Advocate for yourself. Like that was, and I don't even know if there's a word in Spanish for advocate, but I remember telling my husband, this is what I learned from all my experience, advocate. And that's what saved me in the hospital. And that's what makes me want to share my story, because I know a lot of women might feel not empowered. And sometimes, I had friends who had babies years ago and they're like, oh yeah, I'm still having painful sex. And I'm like, why haven't you done anything about it? Wait, can I do something about it? Mm-hmm. Yes, you can go to PT. You can go to acupuncture. You can eat an anti-inflammatory diet and just be curious about your bodies.
Mm-hmm. Right. So patient empowerment, that is what the basis is of the SEED program, is to teach women how to be more empowered in a process that feels like you are completely disempowered.
Yes. Right? And it's very helpful in motherhood, I would say.
How so?
Because, you think that the hard part is making the baby, and then you have the baby, and this is for a lifetime. And, you get into new fears, you get into new, experiences, and you're raising someone else. So for me, patience has been key. Like if she's not sleeping all the night, like it took me years to get to this point. I'm not going to feel frustrated or ruin my day just because she's a baby who can't sleep 12 hours. Mm-hmm. She's not supposed to sleep 12 hours.
The process has taught you to be patient.
Exactly. And to be very thankful. Like every time it's tiring, it's frustrating sometimes, but it brings me back to all my process and being thankful.
Yeah. Well, and if you get sleep deprived, then on that day you want to eat really well so that you can use food to restore some of the lost energy that came from a poor night's sleep.
Yes.
And it is that trade-off all the time with the different decisions and how to keep yourself balanced.
Yes, absolutely.
So yours is really a journey of self-love and knowing the self and coming back to trust the self. We could call it fertile confidence was rebuilt, all the good, empowering things. I'm so grateful for your share. And I know that the women will get so much value from your story.
Thank you. I think I shared this with you before, but something that one of my favorite things about the SEED program was listening to other women's stories.
Right.
Because they gave me options where you think like this is the only way to become a mother. And then you start hearing different stories.
This worked, that worked.
And they're
this
all
is
happy.
How I did it.
And they're all very, very confident of their decisions. That I remember every time, because you share a story after each one of the videos. And I said, this is great. I'm very thankful for you, but for them,
yes.
Sharing their stories. And I feel like if I share mine, I mean, someone out there can listen and, think, oh, she has a similar story to mine. If it happened for her, it can happen to me. And that's what I kept thinking every time I heard the stories. And it's not just becoming a mother, it's becoming okay with your process.
Well, you know what? I have a surprise for you. And yes, your story has a happy ending, and we're so excited about that.
Yeah.
But this interview has a happy ending as your surgeon, Dr. Larry Orbuch, is here. And I thought it would be fun for you two to get a chance just to sit. Now, you are a mother, and just to thank him in person.
Yes, of course.
Okay, let's bring him in.
Thank you.
Hey, Dr. Orbuch. You remember Andrea?
Hi, how are you?
Good.
So she has wrapped up a wonderful discussion interview of her story, and you played a really big role in this success story, getting Matilda here and then helping her after she was delivered and she had the uterine atony. So we were just wrapping up endometriosis, Endo March, and I would like to jump in if you would like to say a couple of things about her case, that's things that other listeners would benefit from.
Sure. Well, first of all, I want to thank you for including me. It's great to be here. I think just in general, and I think you're both familiar with it, just the key to success is really embracing the totality of what needs to be addressed when it comes to endometriosis. It's not just a surgical problem. And that's unfortunately how many physicians view it, is that it's something that needs to be removed. And, whatever that yields as far as results is basically all that you're going to get. And they don't take into account the cumulative effect or impact that the endometriosis has had on the individual in many different ways, and affecting many different organ systems and just their general being. And I think that when you don't address all those things and and I'll get into more of it in more detail, but like the coexisting pain generators and other issues, then you hit that glass ceiling of improvement. And you don't achieve what I call, getting to feel as good as you can feel, and really be able to move on, with your life.